Good morning, everyone. This is Dr. Anthony Chang, your privileged host for our first monthly AI Med update. It is June 6th today, and lots of things are happening in the news with AI and also as it relates to healthcare. The biggest news of last month is GDPR, and why is privacy now stronger in the EU than the US. For those of you who may not know what GDPR is, it's General Data Protection Regulation, affects actually all aspects of data collection and storage, as well as use of any EU resident's personal data. And this requires any entity, not just companies, to obtain a consent for data. And in larger firms, it's actually required now in the EU to have a data protection officer. So that's a new job description, a DPO. And then the penalties can be pretty high. And it's $25 million or 4% of global annual revenue, whichever is higher, not lower. And for a large company like Google, that could be in the multi-billions range. Another significant news is the emphasis of AI in healthcare. That is from Theresa May, the Prime Minister of the United Kingdom. And she gave a speech emphasizing the potential of AI in early diagnosis of cancer. And she estimates that AI in healthcare can save at least 50,000, that's not loves, but lives a year. Could be loves too. And then data sharing and AI in medicine remains, as you know, controversial, especially given the recent event between Google and NHS. So, but I think it's very promising that the Prime Minister is focusing on AI in healthcare. Another piece of good news this side of the Atlantic with the AMA is that AMA is proposing a policy of AI use in medicine. As you know, even though 67% of clinicians and healthcare stakeholders, according to a HIMSS Analytics survey, believes that AI will have potential to transform healthcare, only 10% of providers feel comfortable understanding the technology, and 4% believe that their organization is ready for this. So the baseline AI in healthcare policy is designed to guide healthcare stakeholders in general, as well as federal policymakers, for AI-enabled products. In addition, it's noted that the two main sectors are wearable devices as well as diagnostic and decision support tools. In China, had an opportunity to visit China recently and will be going back next week. China has a particularly significant problem with chronic diseases that need chronic disease management, particularly hypertension and diabetes. And as you can see in the graphic, Alibaba, the health sector in Alibaba is investing even more heavily now in AI and healthcare, particularly three areas: intelligent medicine, internet-based medical services, and personal health management. And Alibaba's AI medical laboratory, for instance, with smart diagnostics, has partnered with 3 different hospitals. There is competition from Baidu with Baidu Brain and a chatbot for doctors and patients, and also from Tencent, which is developing an AI-driven medical product called Miying, which is dealing with invasive procedures. So seems like there's a lot of money being invested in China's AI and healthcare sector. One important update is from the area of diagnosis of melanoma. And this headline says AI beats doctors at cancer diagnoses, which is always attention grabbing, but not entirely true. This is a study that was published in the Annals of Oncology that showed deep learning convolutional neural network, or CNN, is proving to be superior to a group of dermatologists from around the world. And this was trained with over 100,000 images of both malignant melanomas as well as benign lesions. And this international group of dermatologists were not able to be more accurate than Google's CNN architecture. But again, I think the takeaway here is we don't want to necessarily promote a competition between doctors and deep learning, but it's more a collaborative, synergistic effort. Medical imaging AI software is also vulnerable to covert attacks. A few Harvard-trained biomedical informatics showed that this medical image interpretation software that is starting to become more common is very vulnerable to cyber attacks for a number of reasons, but including insurance fraud, and that it was relatively simple to a simple process can actually be automated. So we need to make sure that as we develop medical imaging software that we can protect them from cyber attacks. So this is a cartoon of the month. You're not being replaced by a robot, the supervisor says. You're being replaced by someone who understands robots. So maybe that could be drawn as an analogy to clinicians and also other healthcare stakeholders that it is time to try to understand something about artificial intelligence. I'm mentioning this article of the month from Journal of American College of Cardiology. As some of you know, I'm a cardiologist, so this is a particularly good review article. A senior author is actually one of my Stanford alumni, and the whole article is convincing all of us that artificial intelligence, not just in radiology and pathology and dermatology and ophthalmology, but also is going to be very well suited for cardiology use of artificial intelligence. Cardiology has a lot of imaging modalities as well as chronic diseases, so artificial intelligence will be particularly good and well suited for cardiology. I'm a pediatric cardiologist, so it's even more beneficial, I think, because there seems to be more heterogeneity in diseases for children with congenital and acquired diseases. Just a few other noteworthy elements. One is the book of the month is a book titled Human Plus Machine Reimagining Work in the Age of AI. And it's authored by some leaders at Accenture, the management consulting company. This is research over 1,500 companies and with their perspectives on AI. They introduced the concept of the missing middle, which is what's between machine and human. And they aptly describe this missing middle as a huge, dynamic, diverse space in which humans and machines collaborate to attain orders of magnitude increase in business performance. And that new roles that involve a human-machine hybrid will be formed to fill this void. And I think my personal opinion is that this book is particularly applicable to the use of AI in medicine and healthcare because we do need a lot of people to navigate this missing middle space for AI to really attain significant height in medicine and healthcare. The Journal of the Month, I'm proud to say that Charlie Maloney, the editor, as well as Freddie White, the CEO of AI Med, and myself have really worked hard to give you a hybrid between a scientific journal, which in 2018, I think less and less people really reading in depth the scientific journals. And we wanted to present a hybrid version of the scientific journal and an industry magazine. So we're calling it an academic magazine. And there are a lot of sections that you'll find interesting. The upcoming issue is actually on medical imaging. The second issue was on the future of wearable technology. There's sections in this academic magazine that I think will be appealing to everybody. Also, there's an upcoming journal, brand new. I have nothing to share with you right now except the title. It's in the planning works. I'm privileged to be asked to be on an editorial board. It is the Journal of Medical Artificial Intelligence, or JMAI. So that will be forthcoming in the next few months. we're in the planning stages of the first issue. The website of the month is also related to AI Med, and this is a wonderful website, ai-med.io, and it's full of resources. The magazine is on the website, all the events, including the big meetings and the breakfast briefings and locally, as well as the ebook are all on the website. And speaking of upcoming meetings, we are gathering clinicians with a strong data science interest. You'll be interested in knowing that this is the inaugural meeting called AI Plus MD. The name is still evolving. Perhaps the name also could be Medical Intelligence Group, but it's basically clinicians and anyone else who is particularly interested in the space between medicine and data science. The summit will be August 15th and 16th. It's intentionally coupled to the Learning and Healthcare, or MLHC meeting, the Machine Learning and Healthcare meeting on August 17th and 18th to occur at the Stanford School of Medicine in Palo Alto, Northern California. So you can travel and be at both meetings at the same time. And then, of course, our three big meetings that are coming. One is in Europe, in London, September 11th to the 13th. And the second one will be in Hangzhou, China, and that's going to be November 8th to the 10th. And the flagship meeting will be back in California on December 13th to the 15th. So the registrations are open for all three meetings, and we're looking forward to seeing all of you. And this is Dr. Anthony Chang for AI Med, and giving you a quick update for the month of June. We'll see you next month.